24 million adults in Africa are currently living with diabetes, the World Health Organization has said, and predicts the disease would increase by 129% to 55 million by the year 2045. WHO representative to Ghana, Mr. Francis Kasolo, made this disclosure in a statement read on his behalf at the commemoration of the 2022 World Diabetes Day under the theme Access to Diabetes Care. He'll appeal to governments of WHO member states to prioritize investment in essential diabetes care products to ensure equitable accessibility for everyone living with the condition. Acting Program Manager, Non-Communicable Diseases at the Ghana Health Service, Dr. Efua Kome, described the 6 to 7% prevalence rates of diabetes as alarming.
We need to continue educating Ghanaians about what is healthy and what is not. Because if people don't know, they won't be able to ask the right questions. And even pressure provided by civil society comes from awareness. So once people know, they'll start putting the right pressure on policymakers and insist these sugar-sweetened beverages you talked about, they give us so much harm in terms of our health. But if they are not appropriately addressed, it will be difficult. And because of the industry play behind it, it's not easy to just tell people to stop their productive workforce because it also presents a certain harm. And when the population starts demanding answers from the politicians, from the policy people, from the implementers, then you see a gradual shift. So we need to start from somewhere, regardless of where we find ourselves now.
Deputy Minister of Health, Mrs. Tina Mensah, launched the commemoration.
Diabetes goes beyond the health system. I once again want to state that we appreciate all the efforts undertaken by partners to support diabetes care in both children and adults. In this regard, we call on other partners to come on board to help prevent and improve diabetes treatment outcome in Ghana. Together, we can do it. The message remains: early detection saves lives.
There were solidarity messages from other partners in the control and management of the NCDs in the country who mentioned various forms of support in the prevention and management of the disease.